Postdoctoral Vacancies in Public Health. Postdoctoral Fellow in Public Health. This position has an initial appointment of 2 years with the possibility of renewal and offers a benefits package found at Postdoctoral Fellows benefits. Location: work primarily takes place at North Campus Edmonton, however, a remote or hybrid option is possible. Working at the University of Alberta. The University of Alberta acknowledges that they are located on Treaty 6 territory, and respects the histories, languages, and cultures of First Nations, Métis, Inuit and all First Peoples of Canada, whose presence continues to enrich their vibrant community. The University of Alberta is a community of knowledge seekers, change makers, and world shapers who lead with purpose each and every day. They are home to over 14,000 faculty and staff, more than 40,000 students and a growing community of 300,000 alumni worldwide. Your work will have a meaningful influence on a fascinating cross-section of people, from their students and community members, to their renowned researchers and innovators, making discoveries and generating solutions that make the world healthier, safer, stronger, and more just. Learn more. Working for the School of Public Health. The School of Public Health integrates the strengths of faculty, staff, adjuncts, and instructors involved in research, graduate education, and various initiatives to engage communities. Theirs is a non-departmentalized faculty made up of several administrative and academic groups, including their centers and research teams. Together, these groups work to fulfill their mission to create knowledge, educate public health professionals, and to advance the public's health. Position. The postdoctoral fellowship position will work within a team of faculty and students across international networks, the Indigenous Peoples Observatory Network, IPON, as it relates to environmental science, climatology, public health, indigenous ways of knowing, and food security. IPON is a consortium of researchers from across 17 countries, including Canada, the USA, the UK, Argentina, Peru, Bolivia, and Uganda. This postdoctoral position is with Dr. Sherry Lee Harper in the School of Public Health at the University of Alberta, and the international IPON team. The research focuses on working with Indigenous peoples globally to understand how the Indigenous climate-food health nexus is affected by climate change, and further the design and implementation of co-produced adaptation and mitigation strategies. Specifically, the successful candidate will lead synthesis work that brings together key findings and insights from across the IPON partner locations. The successful candidate will have the opportunity to expand and enhance research skills, work collaboratively with partners, work across disciplines, faculties, and universities, and be offered mentorship and support in a dynamic and engaging environment. Duties. Develop and synthesize insights from case studies throughout the IPON member countries. Conduct systematic literature reviews, qualitative metasynthesis, and/or quantitative meta-analysis across case study projects. Develop community-based participatory methods papers and commentary papers. Use Excel, Access, Stata, and/or R to manage and conduct descriptive statistics of scoping review and other study data. Lead the development of collaborative manuscripts. Perform interviews to collect real-time lived experiences on stressors that affect food systems and health. Examine current climate-food health nexus and policies related to consideration of Indigenous peoples and their knowledge and impacts of these policies. Plan, schedule, and coordinate the international panel of experts within the IPON. Develop online and in-person workshops for the IPON, e.g. create mapping exercises and workshop materials, cross-sectional surveys of team members, and interview and focus groups of team members. Assist with tracking of travel-related emissions for all IPON partners. Schedule and chair meetings, both in-person and virtual. Minimum qualifications: PhD in public health, epidemiology, environmental studies, Indigenous research, or related field. Preferred qualifications: strong research track record, including community-based research skills, publications, community engagement, and knowledge mobilization. Applicants should possess strong project management skills, including the ability to multitask and prioritize work with tight deadlines. Advance complex projects, and maintain collaborative relationships with colleagues and partners from various disciplines. Experience with evidence synthesis and literature reviews. Strong experience with principles and application of EDI. Excellent communication skills. Creative. Collaborative and strong team player. Experience with online meeting platforms e.g., Zoom, Microsoft Teams, Google Meets. Ability to exercise independent judgment based on defined practices and policies. At the University of Alberta, they are committed to creating an inclusive and accessible hiring process for all candidates. If you require accommodations to participate in the interview process, please let them know at the time of booking your interview, and they will make every effort to accommodate your needs. All qualified candidates are encouraged to apply. However, Canadians and permanent residents will be given priority. If suitable Canadian citizens or permanent residents cannot be found, other individuals will be considered. They thank all applicants for their interest. However, only those individuals selected for an interview will be contacted. The University of Alberta is committed to an equitable, diverse, and inclusive workforce. They welcome applications from all qualified persons. They encourage women, First Nations, Métis and Inuit persons, members of visible minority groups, persons with disabilities, persons of any sexual orientation or gender identity and expression, and all those who may contribute to the further diversification of ideas and the university to apply. This is Scholarship Advert channel. Please like the video.